Hi, I'm Dr. Minerva Santos, and welcome to Your Health Today. My guest is Yaashi, who is a homeopath, and as you know, homeopathy is very near and dear to my heart, and I'm very excited to have her as a guest because it's been very difficult to find a homeopath in the area. She's in Norwalk, which is not that far, so I'm very grateful for you to be here today. Thank you.
Thank you so much, Dr. Santos, for inviting me. I'm very happy to be here. I'm very passionate about homeopathy, so I love to share whatever I can with people. I've realized that I'm more of an educator than a physician because I like my patients to be my partner. I like to tell them what remedy I'm giving them and what my logic is behind choosing that remedy for them, so that if they are not able to get in touch with me next time, they can just go back and look at my email and be like, these were the symptoms and this is what she gave me. And they'll sometimes come back to me and, but this one looks similar, and I'll explain to them why I'm picking the one that I'm picking, and it works perfectly for them.
Now that, it's interesting. First, let's talk a little bit about homeopathy, how it works, what's the basis of it.
Sure. So homeopathy has been around for more than 200 years now. It originated in Germany. So the founder of homeopathy was a German physician. His name was Samuel Hahnemann, and he was actually a regular MD, and he just got tired of the practice of medicine back then. It was barbaric. There was bloodletting. It was horrible. You know that. So he just gave up the practice of medicine. He's like, I can't deal with this. And he started translating the works, the medical works, and he said, this is all I'm going to do. And as he was translating, he read about the cinchona bark, and he read that the cinchona bark produces malaria-like symptoms, and we use cinchona bark to treat malaria. So what he did was he took a couple of ounces of the cinchona bark and he started exhibiting the symptoms, and he proved that. And when he started out, he didn't believe it. That's the reason why he proved it on himself. Then he said that if I'm taking it, the symptoms are so severe, what about if I start diluting it? Maybe the symptoms won't be so severe. And that's how homeopathy was born. And then he started diluting it, and when he gave those very diluted potencies, the effects were just phenomenal. And that's how it started, and he took it from there, and then he started proving various remedies. So the source for homeopathic remedies is plant, animal, could be the diseased tissue, and you take it and you just dilute it by a process called potentization. And what you do is you take one part of the substance and you take 99 parts of the vehicle, which is most of the time alcohol, and you shake it in a certain way and you get the 1C potency. And if you take one part of the 1C potency and 99 parts of alcohol, you get the 2C potency. And the same way, one part of 2C, 99 parts of alcohol, you get the 3C. So by the time you go to the 30C potency, which is the most common potency that's available out there, there's nothing left of the original substance. So it's been diluted so much, and it gives the body just that tiny stimulus that it needs. So if you find the symptoms that the substance can produce, if you see those symptoms in disease and you give the matching remedy, it just stimulates your body's immune system and you feel better with it.
Now, it's interesting that you say that. I grew up on homeopathy. In Spanish neighborhoods, homeopathy is very popular, whether it's for colds, nausea, menstrual symptoms. So I don't think I had an antibiotic until I was an adult, and never realized that it was homeopathy that I grew up on until in the middle of a course I was taking on homeopathy. It occurred to me that, wait a minute, all of a sudden it came back in a flash. This is what I grew up on. When anybody had any kind of illness, that's what we had.
Exactly. And the beauty of homeopathy is that it doesn't matter whether your symptoms are from an allergy, whether your symptoms are from a virus, or whether your symptoms are from a bacterial infection. So if you choose the remedy which is based on the symptoms that you're exhibiting, it will take care of those symptoms irrespective of what's going on underneath. It will stimulate your body's own immune system He'll work gently with it and you will feel better. And it works in acute cases as well as it works in chronic cases. So my practice is mainly acute cases. I love the acute homeopathy because when I went to school back in India, I have a bachelor's degree in homeopathy, which is a 5.5-year degree course. We study all the subjects that a regular MD studies. So we do the anatomy, the physiology, the pathology, the OBGYN, the medicine, the preventive social medicine. And with that, every year we have the materia medica. So we learn the homeopathic remedies to treat these illnesses. So if you go to any modern homeopath, they are not just sitting blindly and taking your history and just giving you symptomatic remedies. They are actually understanding what is going on underneath. So they are able to differentiate between the symptoms that are from the disease and the symptoms that are peculiar and characteristic to you.
Right.
So if I have two people that come to me with a cold exhibiting similar symptoms, I may choose a different remedy for both based on what is peculiar and characteristic in each one of them. So for example, if somebody comes to me with a congestion and a cough, if that person has a weepy, clingy disposition, I might choose pulsatilla. And if the other person is angry, irritable, cranky, I might choose bryonia for that person. So two people, same symptoms, but I may choose completely different remedies for them based on what their personality is and what specific peculiar characteristic symptoms that they're exhibiting.
Yeah, you know, and that whole debate always exists that homeopathy doesn't work, and yet I've seen that it does work. I have a friend who had very severe psoriasis and had a great outcome with homeopathy. And I've seen it work many times, so that I no longer even entertain the arguments with my peers about homeopathy doesn't work because it's really the essence of nothing. Because I have seen that it does work. So I'm a huge believer.
Yes. And again, sometimes people will say to me, it's too slow. It's going to take forever. And this is what I tell them always. Depends on how long have you had the illness. So if you come to me and your illness is a day old, it's going to be better in hours. You come to me with a chronic illness that's been there for 5, 10, 15, 20 years, give it at least half the time of when you've had the illness for me to take care of it for you. And that's the reason why I slowly gravitated towards pediatrics, because they have the illness the least amount of time and I can make them feel better pretty much right away. So just recently I had a 2-year-old child that was sent to me by my very good friend who's a pediatrician, Dr. Diana Lopusny. She practices in Milford. And all the patients that she really can't help, she just sends them to me. I don't know what to do with these patients. Yaashi, take care of them. So she sent this 3-year-old to me. His only complaint was frequency of urination. He was going every hour, every 2 hours. His urine report was normal. The culture was normal. There was nothing that she could do for him because she's like, he doesn't have an infection. What do I do? Based on his frequency of urination and the slight pain, I picked the remedy called Apis. And you know Apis?
Yes.
And I said, give a dose each time he goes and pees. And that's what the mom did. And like within 4 doses, he was back to his normal peeing. He was going just 2-3 times a day. And all he needed was the 2 or 3 doses of Apis and he was done.
I was a beekeeper, so I would get stung, obviously. And I can't tell you how many tubes of Apis
yes, yes,
around the house.
Yes, yes.
And how helpful it was,
Yes.
because a bee sting is a bee sting.
Exactly.
And the more you get it, the more you react. And it got to the point where if I got stung, I would take the Apis and I would have nothing.
Exactly. So any kind of allergic reaction it's great for. Patients who have peanut allergies, patients who react to anything, you don't even know what you reacted to. So if you have the slight swelling, the redness, and the itchiness, burning, these are the symptoms that are an indication for Apis. And I always recommend that in an acute situation, don't be afraid to use the remedy. You can use it every 5 to 15 minutes. And then as you're better, you give it every half an hour, 1 hour, every 3 hours, and then maybe once or twice a day, taper it off and stop. So this is not like allopathy where you are giving it 3 times a day or 4 times a day. In the acute situation, use it as much as you need to, and let your symptoms point towards the frequency of repetition. So as you're getting better, you don't need to use it as much.
Right, and that's another thing people need to realize is that homeopathy is very safe. And I know this from experience because as a 5-year-old, I went into my mom's pocketbook and ate one of the whole tubes because they're sweet.
Yes.
And just had a whole tube full. So
Yes.
I'm here to talk about it. So it is safe.
Yes.
I use it, a lot of the OBGYNs will send their pregnant women to me. And that's where I actually will use homeopathy
Yes.
over herbs.
Yes.
Because it is safe, and it is safe for pregnant women. And that's my preference. Then that's pretty much where my little niche is, just with pregnant women using the homeopathy for colds and sinus congestions.
Yes, yes. And also what happens is that this is the other thing with it. You can take one tiny pill, and that's the equivalent of 1 dose or 1 stimulus for your body, or like you did, take the whole bottle and it's still 1 stimulus. So you can take the whole bottle at one time and it's 1 stimulus. And you take one tiny pill and it's still the 1 stimulus. And so that's the reason why it's safe. Now, I have a little caution that I want to, share with people. Sometimes if you use a remedy, there are some individuals that are very sensitive to the effects of the remedy. So I don't want to say that homeopathy is totally safe. I always say have a professional homeopath guiding you, advising you when you start using it. And then once you become comfortable using it, sure, go for it. But if you're new to homeopathy, I recommend that you get a professional homeopath guiding you along so that you know what you're using, because sometimes you read it and you're using it, but there are remedies that are complementary to each other, remedies that follow well with each other. So I'll have patients who'll come to me with symptoms and they say, you know what, I took the Spongia and I took the belladonna, but I didn't feel better. But now when you're telling me to take it in a particular way and in a particular sequence, I'm better. So that's where the professional homeopath comes in, because we are able to guide the patients in telling them which remedies are complementary to each other, which remedies follow well after each other. So, and the key is to switching the remedy in an acute situation if the symptoms change. So, for example, I love aconite. So I always say to take aconite at the onset of symptoms. So anything that comes on suddenly, so if you have a cold, a cough, like today it's raining, the weather changes and you start to have a runny nose or a slight cough, take the aconite right away. A couple of doses of the aconite will nip it in the bud and you'll be fine. So the first 12 to 24 hours, I recommend the aconite. Now, if you've gone beyond those 12 to 24 hours and you have symptoms, if this cold and cough has now evolved into a sinus congestion with just a thick, bland discharge, and congestion, chest congestion and nasal congestion, one or the other, your remedy is now pulsatilla. So you have to now switch over from aconite. You can't indefinitely take the aconite, switch to pulsatilla. Now, if supposing instead of that, you have a runny nose, you have sneezing, you have burning, and you have that whole feeling of, that you can't stop, it's that bad, the eyes are watering, the nose is running, it's a clear discharge, now you need the arsenicum alb. If instead it's gone into your throat where you're constantly feeling the need to clear your throat and the congestion is nasal and more in the throat, I would say now reach for the Hepar sulf. So it's important to switch to the indicated remedy as your symptoms change. Your symptoms are the one that should guide you to which remedy. And you're going to feel better pretty much within a couple of doses. So if you're not feeling better, you're not on the right remedy.
Right.
So you need to switch.
Right. And, it's interesting how most people just think of homeopathy as Arnica.
That's true. That's another one of my favorite remedies. I love Arnica. And it's great for, especially now during the summer when your kids are going to be out playing, they're going to get bumps, bruises, and Arnica is great for that. Arnica is also great for post-surgery. So it'll really help patients come out of it quickly and heal quicker. Like when my husband had his back surgery, the Arnica, and within a day he was up and about. So it really helps with the healing process.
It also helps with the bruising.
It helps with the bruising.
A lot of the plastic surgeons now are using Arnica
yes,
so that you don't get big raccoon
exactly
look on your face. Yeah.
The caution with Arnica, You don't want to use it externally if you have a cut. If there's an open wound,
Right.
you don't want to use Arnica. Then reach for the Calendula. So that's where
Yes.
the Calendula comes in. So if it's an internal, there's no breakage in the skin, any bruising, sprains, you stretched a muscle, you exercised too much one particular day and now you are feeling the pain, you went on a hike, you went for a long walk, you played a rough game, anything, you can reach for the Arnica. And again, you can start off with every hour, every half an hour if you need to. And once you're feeling better, every 3 hours. Go down to 2-3 times a day and you can taper and stop.
What other are your special favorites?
So, my special favorites for this time of the year, since we are,
Okay,
at the beginning.
summer.
Yes, we are in the beginning of getting ready
Then I'll
for
have
summer
you
vacation.
come back for winter.
Yes, I'll be happy to. So this time of the year, I love arsenic. We talked about arsenicum all before for the allergy symptoms, where after the aconite, if your symptoms are the runny nose, the watering of the eyes, the burning, arsenicum is great for that. I love arsenicum. It's my favorite remedy. I will not travel without arsenicum. So any food poisoning, and this happens this time of the year, if you're going to be out, you're going to eat out, any food poisoning symptoms, whether it is diarrhea or whether it's vomiting, if you are feeling completely lethargic and are experiencing prostration after each motion or vomiting, the remedy to reach for is arsenicum. So you can take a dose right away after each, whichever end it's coming out of. After you've, finished with that, take a dose of arsenicum right away. Usually within 3 to 4 doses, it'll stop. So the dosage is 1 dose of the arsenicum in the 30C potency right after you throw up or if you have a loose bowel movement. Now, on the other hand, if you're having just loose motions or your child is having just loose motions, which are just painless, and it's the summer heat or during teething, when they're otherwise fine, they're eating, they're playing, and they seem totally all right, but they go to the bathroom 4 or 5 times, and each time they go, the motions are loose. In that case, I would reach for the podophyllum, and again in the 30C potency. So the way to differentiate the arsenicum with the podophyllum is it's painless diarrhea. They go in, the motion is loose, they come back out, they're playing, they're eating, they seem completely normal. But if even after one motion, they're just lying there, not eating, not drinking, completely lethargic, reach for the arsenicum al. So these two are my favorite remedies for this time of the year. I will not leave the house without Nux vomica.
That's my favorite.
I love it.
That's my favorite.
For, again, whenever we travel to India at least once every 2 years. I will give my family Nux vomica. They literally know. They'll just open their mouth when they see me coming close to them. So I will give them a dose literally every day, minimum 1 dose. So it's great for hangover. It's great for the jet lag. So I will give them a dose as we are 2-3 hours away from the airport, landing in Mumbai. And once we get there, I'll give them another dose. And it really helps us. It regulates our cycle so we don't feel as jet lagged as we would normally. And then here we are used to having early dinners. We eat by 6:30, 7. That's not how it works in India. You go to India, 7 o'clock is like a snack time. They'll feed you dinner at like 10. Appetizers start at 8:30. And then by the time you finish dinner, it's like 12 and your body is not used to that anymore. So any kind of dietary indiscretion that you've been out to eat, you've been to a party, the Nux vomica is great.
Or even if you've eaten, I recommend it for patients who have the sensation of when they eat, they feel really bloated.
Exactly.
They feel as if they've had a huge meal.
Exactly.
And for patients who are hungover too.
Hungover, exactly. So a dose before you know you're going to be going out is great as a preventative, and then a dose right after. And then if in the morning you need another dose or 2, it's perfect. So for any occasional constipation. And again, when I'm talking about these situations, this is not something that you would take if it's a chronic problem where you've had it for years. You do need a professional homeopath at that point who can figure out why you're having this for such a long time. This is over-the-counter, non-prescription for occasional constipation, occasional heartburn, occasional indigestion, which has happened from dietary or, dietary indiscretion or a change in your normal regular routine. In that case, a dose of Nux vomica is just phenomenal. It will get you through that situation easily.
What other are some of your favorites?
Some of my other.
There are so many.
Yes, yes.
That, as you talk, it's like, yeah, I tell patients this, I tell patients that, and I'm like, oh yeah, I love that.
Yes. So we went over aconite, hepar sulph, pulsatilla.
Rhus tox.
That's great for this time of the year.
Yes, with poison ivy.
Exactly. I wouldn't, again, it's in my kit. I brought my little kit to show you. So this is my little kit, and it has all the remedies that I'm talking about. So it has my arsenicum, it has my podophyllum, my aconite, my pulsatilla, the rhus tox. And the rhus tox is great for poison ivy. So, and again, any kind of skin symptoms where there's itching, where there are blisters, you can, with a lot of itching, and the key is itching,
right,
you can use the rhus tox. And in the initial stages, use it a lot. You can use it, like I said, every 15 minutes to half an hour, and as the symptoms subside, go to 2 to 3 hourly, and then taper it and stop it. The other remedy that goes hand in hand is your ledum pal. Ledum pal is great, especially here where we live in Connecticut, where Lyme disease is like a huge thing, and we are exposed to ticks and tick bites. So if you have any insect bite, any tick bite, you can use the ledum pal right away. So once the tick has been removed, give the ledum pal within 15 minutes of the tick being removed, and then use it every 2 to 3 hours for the first day, and then maybe 3 times a day for the next 2 days. And if there are no symptoms, maybe once a day for the next 2-3 days, and taper it off and stop. All the families that I know who have used ledum pal when bitten by a tick have not had the Lyme disease. So it really helps stimulate your body that you will not get it. And the way to take the tick off, that you just pull it till the tick lets go itself, and use the ledum pal and you'll be fine. And then again, the apis. We talked about the apis before. Apis is a great remedy for insect bites. If there is redness, swelling, burning, mosquito bites, we can't go to India again without taking the apis with us. I give my kids the bug off those bands, and they're wearing it in their arms, and they're wearing it on their ankles, but I still take the apis. So anytime they get bitten and they come to me, I will give them a dose of apis right away. So they know all the remedies. They'll just come and they'll say, Mom, I need the apis, or Mom, I need the nux. Right. They have their own kit, so they don't even come to me half the time. My daughter is 16 now. I give her own kit, and she just reaches for it, and she's done.
Oh, it's interesting how it works, which is why when people say, well, that doesn't work, how does that work? It makes no sense. It's so diluted. I just say, I can't explain it, but it does work.
I want to share with you what happened with my son. He hardly gets sick because both my kids have been on homeopathy, and they've never had antibiotics. They rarely have had Motrin. So we were going on vacation during April break, and the day before we were supposed to leave, he comes to me in the morning and he's like, Mom, I'm nauseous. I'm like, don't do this to me. We're supposed to go on vacation tomorrow. You're picking today to be nauseous? So I sent him off to school with a dose of Epicac. And Epicac is a great remedy when there's nausea and nothing else. So if there's persistent nausea, you choose Epicac. So I gave him a dose of Epicac. I sent him off to school. And at 12, I get a call from the school. And I'm like, as I'm looking at the call already, I'm going, oh God, no, don't tell me he threw up. And he did. He had thrown up at school. So I went and I picked him up from school. I had my kit with me. And I said, what's going on? He said, Mom, my tummy hurts and my head hurts. So there was no more nausea. It was just stomach pain and head pain. So on the basis of that, I gave him a dose of Nux Vomica. And we came home, and he was fine by the time we reached home. He ate something. He was playing. By 4 o'clock, he had a fever. He was burning up, and he just laid down, and he had no other symptoms. All he had was fever, and he said, my head is hurting. So I chose belladonna for him. Again, that's one of the remedies that I absolutely cannot do without. It's like my homeopathic Tylenol. I hate putting names on the remedies, but that's what it is. It is my homeopathic Tylenol. So I gave him a dose of the belladonna, and I usually will wipe him down whenever he has a fever to help break it. And this is something that my daughter came up with 2 years back. She had a fever, and I gave her the belladonna, and I was wiping her down. And she says to me, Mom, why don't you put the belladonna in the water that you're using to wipe me down with? Won't it get absorbed from my skin?
It's interesting.
And I'm like, this is genius. Why haven't I thought of this before? So this is how much my family is into homeopathy. So I'm like, and since then, we've been doing that. So if I'm wiping down the water that I'm using, I'll usually put a couple of pellets of the belladonna 30C in it, and I'll use a Bounty, go in, just squeeze it out, and wipe their body down with it. So it was, I think, with 2 doses of belladonna, his fever was completely gone.
Wow.
He had juice, he ate, he was playing, and at 10 o'clock, as he's ready to go to bed, again, he's totally fine. He had only one symptom. He said, my feet are burning.
Really?
So, I mean, my kids really challenged me. So he said, my feet are burning. And on the basis of that, I gave him a dose of sulfur 30C. That's the only remedy that has that symptom where there's burning. And specifically, they have the feet which are burning. And if you read the Materia Medica, it will actually say that the sulfur patient will lie down and will put the feet out from underneath the blanket, just the feet, because the feet burn so much. 1 dose of sulfur 30C and he was fast asleep within 10 minutes.
And you went on vacation.
And we went on vacation. That wasn't the end of it. He gets up in the morning, and in the morning he tells me, my thigh is hurting, and he was having palpitations. This was at 5 in the morning. I'm telling you, my kids. So I'm like, palpitations, and I really saw his heart was racing. And he says, my thigh is hurting. So at 5 in the morning, when I just woken up, seriously, my brain is not working at that time. So I just went, I love this website. It's called abchomeopathy.com. And it's like an online repertory. So you just put in your symptoms and it'll throw remedies at you.
All right. So that's, you know what? What is your website? Can you just give us your website?
Yes. So my website is www.homeopathicmedicine.webs.com. And if you go to my website, that has a lot of resources. So it actually has a list of the websites that I love.
Okay.
So there's abchomeopathy.com. I absolutely love that website. Then there's truestar.com. So that actually, if you go, has a list of the common remedies for like your daily ailments.
Right.
So like for headache, for sinusitis,
All right. Well,
for
I want to
heartburn.
thank you for being on the show.
Yes.
Patients, go to her website. I love homeopathy, you know that. So thank you.
It was a pleasure. Thank you so much for inviting me.
I'm going to have you back because there's a lot more to talk about.
Yes, anytime, anytime.